They have produced at this point over 1 million masks of one kind or another to help combat the COVID-19 public health emergency. And before I say a little bit more about this, I do want to give an update, as I do every day, on how we're doing with respect to hospitalizations and testing and further increasing data collection at DPH. As we begin phase 2 here in Massachusetts, which started yesterday, the public health data continues to trend in the right direction. As of yesterday, we've done over 650,000 tests, which makes us a top 5 per capita test player here in the United States. And if we were a country, we'd be one of the top testers on a per capita basis in the world. The average positive test rate is now down to around 4.9%. That's obviously a very significant reduction, over 60% reduction in the number of positive tests as a percent of tests done over the course of the past month. The number of people who remain hospitalized due to COVID is down to about 1,462. That's obviously down dramatically, over 50% since the middle of April. And we continue to anticipate and hope that we see those positive trends as we continue to move forward in phase 2. We'll also continue to expand our testing capacity here in Massachusetts and our contact tracing activity as we move forward. I mean, throughout this crisis, we've been pretty aggressive about expanding our ability to provide information that's particular and important to COVID-19 to the public. And yesterday, we filed an act to ensure the collection of COVID-19 data, which builds on the legislation that was recently passed by our colleagues in the legislature that we signed into law on Sunday night. COVID-19 has obviously taken a tremendous toll on the residents of the Commonwealth and has disproportionately impacted certain populations, including older residents and folks in communities of color. This bill that our administration filed will expand our data collection capability to help address the health disparities and the information that's available with respect to these communities. Currently, the law makes clear that DPH is required to collect data on COVID-19 cases and patient demographics, but what's not so clear is what the provider community and the lab community has to submit to DPH. Since the integrity of DPH's data is dependent on what we get from those entities, this bill would amend the reporting law to require that that information be reported by those other participants in the data collection and service delivery supply chain. We believe that this will help improve the spirit of the law to have accurate and complete reporting and to have everybody who's part of that process compelled to actually deliver the information that we'll be looking for on a timely basis. That, in some respects, gives us the ability to ensure that we get the data we need in the most complete form possible. And for those who don't file under the legislation we submitted, DPH would have the ability to issue fines to those who don't deliver the data. We're also proposing other amendments to address data collection and aggregation. The new law that I signed requires designated elder care facilities to report COVID-19 data for residents and staff. Certainly improved data collection makes sense for nursing homes and skilled nursing facilities who play a critical role with respect to patient care, but the law also includes elder housing complexes, which could come with a few problems. Landlords, generally speaking, do not and should not have access to a tenant's private health care records, nor should they have the burden of reporting that to the Department of Public Health. Our legislation would remove elder housing complexes as a designated reporter. It also includes language to allow DPH to lawfully aggregate this data. Accurate and detailed information is an integral part of our understanding in fighting COVID-19, and we continue to support efforts here in Massachusetts to expand and enhance our capacity to deliver on that. There are also a number of important components to the bill that we signed into law that everybody agreed were the right thing to do. We're hopeful that the new legislation will help put a finer point on data collection for seniors and ensure that DPH has access to complete information to identify infection rates and health disparities across the Commonwealth. And we look forward to working with the legislature to pass these updates to help further ensure that we get the information we need and that we can do what needs to be done to address health disparities affecting these communities. This is one. Today we are here at New Balance in Lawrence. The Lieutenant Governor and I have both been here on a number of occasions to talk to these folks about manufacturing in Massachusetts and making footwear. We've done a few of these visits around companies and organizations that have pivoted to create PPE here in Massachusetts. Many of them are partners of ours through the Massachusetts Manufacturing Emergency Response Team, so-called MERT. The initial goal was to get PPE in the door to support our frontline healthcare workers and protect patients from COVID-19. The MERT was helped by executives from our leading healthcare institutions, including folks at Beth Israel Lahey, Mass General Brigham, and a number of others, to provide direct feedback on the needs of frontline healthcare workers, and we were also helped by experts at the Lincoln Lab at MIT and a number of other academic and research institutions. Demand for PPE in the healthcare sector still exists, but so does demand for other types of supplies like face coverings and gowns that businesses, child care centers, and manufacturers, among others, need to reopen. And we're proud that so many Massachusetts manufacturers have stepped up, like New Balance has, and will be there to meet this demand in the months ahead. The MERT program helped New Balance with regulatory assistance, coordinated some supply chain needs, and access to testing products. We had experts from MIT who held bi-weekly meetings with New Balance to talk with them about the regulatory environment with respect to the supplies they were looking for, and the Advanced Functional Fabrics of America Institute that's located in Cambridge also provided guidance around testing. In the short amount of time, New Balance, as I said, has been able to produce over 1 million masks. They've also helped repair straps on 50,000 masks for Brigham and Women's Hospital that were initially degraded when the hospital received the equipment. And to Jim and to the rest of the New Balance team, I just want to say thank you for your efforts to not just continue to be a great employer and manufacturer here in the Commonwealth, but to diversify your product line so that you could be part of the answer to how we deal with and fight COVID-19 here in Massachusetts. We're enormously grateful for your efforts. We certainly know that the work is not done, but to be able to go from zero to actually producing PPE face masks here in Massachusetts in 4 days, as I understand from the conversation we just had, obviously is extraordinary. All the companies here in Massachusetts that have participated in the MERT program have produced nearly 4 million items of PPE in about 120 days. It's quite a story. And last week we launched a new business accelerator program to get even more of Massachusetts manufacturers on our MERT pipeline to produce PPE and other supplies for employers, businesses, and individuals here in Massachusetts. We're obviously very grateful to Carolyn Kirk and the Mass Tech team for the role they've played in making all this happen, and we're looking forward to seeing this new accelerator program build on the work that's been done to date so that we can continue to make sure that people can source, supply, and find the gear that they need right here in the Commonwealth. I want to thank all the manufacturers and suppliers who've been part of this program so far. It's been a great success story. We look forward to continuing to build on it and to grow additional capacity to support people here in the Commonwealth.